It's fun. Oh my God, no.
It's in the other corner.
Okay.
Alright, you ready for me to start? Good evening, everybody. Welcome. Thank you so much for joining us. Before I get going, I'd just like to first of all welcome all of our online audience tonight. And for those of you here in our rooms, please don't be concerned about cameras. This is just for the benefit of those who are watching us from a distance tonight. And I'd just like to say, it's such a great pleasure to have people join us from all over Australia to be able to tune in and access the information that we're going to share with you tonight. And we really appreciate you joining us. Before I actually get going, there's a really short video that I'd just like to show you, and then we'll make a start. So just take a moment to show you this.
What will your last
To an amazing weekend that was focused on heart, brain and obesity and the links. And I think, the reason I showed that to you tonight is really all about what are we looking for when we're looking at managing weight loss and bariatric surgical patients. It's all about longevity in the future, that we want to see our patients eventually being able to live functional, fit, healthy lives and independent lifestyles. And it's so much more than just a one-year program treating and managing and getting you to a goal weight. It's all about getting you to live your, the goals for your life, for your future, for the rest of your life. And that's why I felt that was such a powerful video. How did you respond to that? Really impressive story to tell. And, we know that there are so many diseases associated with being overweight and obese. And obviously, heart disease, stroke are top two diseases that we, want to make sure that we're setting you up for a future that's going to prevent you from ever being faced with those issues. So I just wanted to start with that tonight, and hopefully we're going to be around for a long time and sharing many healthy, active opportunities to get to know you better over time. My name's Felicity. I'm the CEO of Weight Loss Solutions Australia. Tonight I'm going to introduce you to some of our team who are going to share with you a little bit about their roles, what they do here, what to expect when you come through our centre, and what does it look like to be engaging with us over a 12-month program once you've actually gone through a bariatric procedure, whether that's surgical or non-surgical. So first of all, I'd just like to introduce you to the team. Carol tonight is going to give you a rundown on the procedures. Warren is our psychologist. He's going to tell you all about his role, what to expect when you come and see a psychologist. Erin is our dietitian team member. She'll tell you all about what to expect when you see her. And no, she's not the food police. So don't worry too much. And then we do have a couple of special guests who are going to actually share their stories with you. Tammy's actually new to our team, but tonight she's actually going to tell you all about her weight loss journey. And I have another special guest arriving a little later who I will look forward to introducing you to. I've given you all a notepad and pen. I'd just like you to start by taking a moment to think about if there were three things, the top three things that you'd like to see change about your life following gaining that opportunity to get to your goal weight. What are the top three things that you'd most like to see change? And just take a moment to reflect on those and write them down. It could be something like being able to tie your own shoelaces. It might be you'd like to be more mobile and play with your kids. Or you'd just like to see better resolution and control of your type 2 diabetes. So whatever those things are for you, just take a moment to write those things down. And at home too, please take the time to do that and maybe share with us online. We've got an online chat function running, and our team will be able to answer questions for you. So please just take that time to think and reflect and hang on to that for yourself to look back at later on in the evening. So I actually like to give a theme to our information sessions. We run these every month. Tonight, the theme of our information night is Tired and Lethargic, Regain Your Energy for a New Life. And I think, you know, when we're talking to patients coming through our clinic, that one of the things that we hear a lot is that they're run down, they don't have enough energy, that they'd like to have more energy. And there's so many different things that contribute to that when you're an overweight person. Probably one of the things that I see, you know, typically would be the impact of something like sleep apnea. And sleep apnea is so common in our patients, and I would probably be confident to say that it reaches well over 80% of our patients, whether they've been diagnosed in the past and sleep with a CPAP machine, or whether they're just aware that they're heavy snorers and that they might have some underlying, you know, whether it's just minimal but slight sleep apnea. And what does that do? You know, obviously it's going to reduce your ability to get a really great night's sleep, and it's minimising your daytime energy at the same time. So it becomes a really vicious cycle. But what we see with our patients when they come to us, and that's one of the major concerns that they have, is that they're actually reducing their sleep apnea and controlling and getting off CPAP machines sometimes as soon as 2 weeks after surgery. So it's just one of the things that we see that's giving people renewed energy. So just something to think about. Any questions before we make a start about the process, what you're going to hear tonight? Please make this about you. Make sure that you leave tonight as well informed and as well educated as you possibly can be, and make the most of the opportunity to ask your questions. That's what we're here for. So any questions that you've got, just fire away and we'll do our best to answer them. All right. Yes, Julie.
I'm interested in knowing what kind of exercise is most beneficial after the surgery.
I love that question. And I have to say, you know, for many years I've been a little bit probably reluctant to focus on talking too much about exercise, but it's one of my favourite subjects. And having been to this Heart Brain Obesity Weekend recently, the preventative cardiologist who was the guest speaker over 3 days spoke a lot about exercise and the benefits of exercise. There's no underestimating what the benefits are of exercising, but maybe even start with walking. You know, it's great exercise. It's weight bearing, so it's really good for you in terms of prevention of osteoporosis and other bone type diseases and maintaining great bone density. So yeah, start with walking, and we can always work on giving you ideas on exercise programs as you get to that stage where you're ready to take on more. And that'll happen naturally over time. You'll want to do more. We actually like doing all sorts of events with patients. You know, we recently did the colour run. We've done things like walks and runs at the Gold Coast Marathon. So, you know, the opportunities are endless, and we like to engage with you and get involved as well and give you ideas and set up some goals for you. And you've got some great team members who can contribute as far as ideas on what to do for exercise. So the dietitian's a really great one to talk to about exercise, as are both of our psychologists. Warren actually has a background in sports psychology as well, so he's a great one to also help you. So yeah, lots of people here willing to get you involved in exercise and push that as an actual benefit for longevity and so many different things for your health. So yeah, we'll definitely keep focusing on that. All right, so I think I might just start with Carol. She's going to come up and give you a complete rundown of all of the procedures we offer. Please make her welcome.
Hello. Thank you. Excuse my back for just one moment. There we go. So thanks again for coming out. Good to see you all. Can I just acknowledge just a few people? There's Cherie, Patrice, Holly, Amanda, Danica, Jane, Robert, Arlene, Beck and Jasmine, all online watching. So you can actually feel like the room's got bigger all of a sudden because of the amount of people that are online watching as well. So as Felicity said, my role tonight is to talk to you about the procedures and try my best to explain them for you as to what each procedure is like. So please feel free to ask me any questions as we go along. So we here at this centre have been doing this for just over 15 years now. So we've seen just about every scenario you could imagine. We've also seen so many successes, and it just makes our job that much easier when we see the amount of people that come through our doors, and then a little bit later we see them and they're just doing things that they've never even thought of doing before. So that's a great thing for us. It's a very positive place to work for that. And just to add with Felicity, when you were asking about the question about the colour or about exercise, when we did the colour run, it's called colour run, but let me tell you, we did a colour walk a lot of the time, mainly because there's so many people and it was just so uneven, and all you wanted to do was walk past where they're going to spray you with colour and have a bit of fun. So it didn't necessarily mean that you had to run the distance, but the walking was just as much fun. So let's start off first of all with the Orbira intragastric balloon. This is the diagrammatic version of the Orbira intragastric balloon, and this is the actual balloon filled, not to capacity, but a small version of the filling of the balloon. And this is the balloon deflated. So the Orbira intragastric balloon is a non-surgical procedure. It's put down inside your stomach by what's called a gastroscopy. So the scope will go down first of all, and you're under what's called conscious sedation, which means you've got a little injection that's put into your hand. You don't know anything. But if you were a fly on the wall watching somebody say, well, would you just open your mouth and swallow? You'd actually be able to do that. So it's quite intriguing what these drugs will be able to do for you, that you just don't know anything, you're not aware of it, and you certainly don't remember it. So once the gastroscope is down and doctor has a look inside your stomach, then this is passed through into your stomach. It is inflated so that it's inflated to a level of whatever doctor would see fit, but usually somewhere between about 600 and 700 mils. I'll pass it around so that you can see what it's like. The 600 or 700 mils is actually saline, so it's got nothing in it that can hurt you. But it is coloured. It's coloured with a blue dye called methylene blue, which is something that is used in the bodies when they're looking for lots of different things like leaks in your bowel or something like that if you were, sick for another reason, or in kidneys and those sort of things. The methylene blue can be used. And the reason that it's coloured with that is because if, for instance, that valve of the balloon was to leak, then the fluid would seep out and your urine would turn fluorescent green. And so that's a really important thing to know, because if the balloon starts to leak and deflate, then it could block off the outlet coming through this way. Okay, and certainly we don't want that to happen. I've never actually seen that happening, never seen it happen to anybody, but the people that make these things need to have those steps put in place. They need to be able to have precautions of what would happen if it did leak. What do we do about that? So that's an early alert system, so that you're aware that if anything was to go wrong, you can find out about it and act on it by calling the clinic or, going to your emergency. We usually suggest that you call us and we can guide you through it. The balloon is put inside the stomach for 6 months, so it's a temporary procedure only. It's really beneficial for those who want to lose somewhere between about 10 and 15 kilos. We've seen people lose nearly 30 kilos. We've seen people lose, 8 to 10. So it does vary, and it does depend on the person and how, I suppose, committed they are as well to their program. Even though the balloon's in for 6 months, we offer a 12-month program because we want you to be consolidating afterwards what you've learnt in that first 6 months. So once the balloon comes out, we want you to be able to continue on either with the weight loss or also to stabilise. And that's where the dietitian and the psychologist come in, apart from the educating beforehand, but afterwards to help you maintain that loss, to help you keep up those changes that you've already taken on board. And some of that might be exercise, or some of it might be mindful eating. Some of it might be, just choices of food, or portion control, for example. So that's the advantage with the balloon, is that you can have it in for a short time, have a successful weight loss, have it removed. Some people might need to have knee surgery, for example, and they can't have it until they lose 10 kilos. This is a great way of doing it if they're struggling. Okay. When the balloon comes out, it's taken out the same way that it's put in. Obviously, it's not going to be with the balloon inflated, so they do need to be able to grasp it and suck out the water in it so that they can bring it up the same way. Just before removal, we advise you to be on fluids only because we don't want any food particles to be caught in that balloon if it was to be brought up and you could aspirate that. That's one thing that we certainly wouldn't want to happen. So we do advise that you're on fluids only for a few days, but that's something that the dietitian will guide you through. You don't usually feel it in there. People can exercise with it in there. The downtime it's a day procedure. You're usually out of action for a few days afterwards, mainly because the balloon's sitting inside your stomach and your stomach is reacting to that. It's saying, I don't want this in here, why isn't it going through? And so you get nausea and you may get some cramping. The medication that you're given helps with that, but it really does take a few days to settle down. You are required to be on one tablet for the whole 6 months, and that's usually Nexium is the one that doctor chooses. It helps reduce the acid so that you're not having that acid build up around a balloon. Okay, does that make sense?
Are there any side effects to that drug?
Not usually. It's a pretty safe sort of drug. You know, if you weren't, if it didn't agree with you for some reason, there would be another choice that the doctor could put you on, no problem. Yes.
Does it make you feel full? Does it? Is it the idea?
It is the idea, but basically what it's doing is taking up space in your stomach that you can't actually fill the rest of. You know, you can't put a lot in, so you're only able to eat small quantities because there's already something in there.
Okay.
So that's why it's important after the balloon is taken out and you've got your full capacity stomach back that you continue on with the program to make sure that you don't go back up again.
So that's because of the question, how do you self-adjust then? Once the balloon's in there and you're eating your usual, what happens? Do you end up being sick, or do you end up making yourself sick, or is it you overfill and have to purge? How does it?
When the balloon is in?
Yeah, how does it self-correct? How do you get into that?
Basically, you don't feel like eating anymore. Now, I've actually had a balloon. So even with a salad, I would find actually when I ate a salad, that even though I ate slowly and I didn't eat a great deal, I could feel so full afterwards. I'm sitting there going, oh, why did I eat that extra bit of salad? And you think that would be okay, but essentially the balloon does sit around about here. So you've only got a small amount of space for the food to come in, and then it digests around the balloon. The other thing with the balloon is that you can manipulate it. So you need to be able to just have a little bit of education here in the clinic. What happens is that the stomach doesn't sit up and down like this. It does curve around. So the balloon comes down here. And if it goes down a little bit too far, you might feel a little bit, why can I eat a lot, but then I feel a little bit unwell, and yet I was feeling fine before. So what we've got to do is manipulate the balloon so that it's sitting up higher, and then you can have that small amount and it's still allowing the food to go around the outside of the balloon and go out as normal. Okay, so you sort of do self-regulate to a degree, because you really can't fit a lot in. Now, you can push past it, I suppose. You might actually push the balloon down a little bit, but that's where people find that they become unwell, and then they usually have a vomit with that. Yeah.
So it won't reduce the size of your stomach.
No.
Like when you diet, your stomach usually shrinks. That's fine, isn't it?
Yeah. Normally what happens is that your stomach just readjusts to having a smaller quantity of food, and it's an elastic organ. So yes, it can stretch right up and then it can sort of, come back down again. But the balloon just sits in there, and so you don't feel like eating more. When the balloon comes out, for the first week or two afterwards, you still feel the same. You just don't feel like eating a lot. So that's the best time to take advantage of that portion control and continue on with the portion control, so that then you think, okay, well, no, I don't need that. Maybe what Erin would talk to you is about, do I need to have a little bit more protein in my diet so that I'm not feeling hungry? Do I need to have more fibre so that I'm actually eating and chewing more, but I'm not overeating in other types of food? And then the other thing is that it's usually also an opportunity to get rid of some of the stuff that you used to eat that might not have been so healthy. And you can still have little bits of that, but it's a matter of going a little bit is okay.
So you still have to have that diet program in place, definitely. It's obviously, because just like, did you say the stomach can stretch? You could potentially stretch it even with the balloon inside again. Is
Yeah,
that
if you
right?
wanted to force it, yes.
Yeah.
But you wouldn't feel good about it.
No,
You'd
sure.
probably vomit a lot
Yeah,
with it,
yeah,
I'd
yeah,
expect. Yeah.
No, I wouldn't be too.
Because
personal
it's only
on that.
so much that you can put in when that balloon's already in there.
Yeah,
You know, and you've got to, what I've shown you there is probably only maybe about 400, 450 mils there. It's not
so
like the
that's
600,
not-
700 mils, that, you know, it's quite firm. It's
And
not
that's so-
squishy.
That adjustment thing, how often would you have had to have done that when you've got that? When you've got your stuff, you're saying you sometimes have to manipulate it?
Manipulate it?
Yeah,
Only just when you feel, once you've been shown how to do it, you can do it yourself.
okay.
You
So
know.
is that a daily thing or a?
To start off with, sometimes you could, like I would wake up in the morning and I'd feel the balloon was sitting a little bit forward,
Right,
and all I would do is just do this, and then all of a sudden it went back. I thought, oh, okay, I feel good now. And then after a while, I didn't have to do a thing. It just seemed to sit in its right
Okay.
position.
okay.
Some people might have to manipulate it a little bit more, but it's a very simple thing to
Okay.
do. You know, it's not like you've got to take time out and come and visit and let's have the balloon manipulated. It's nothing like that at all.
Ask somebody to give you a couple of swifties.
Yes, exactly, nothing like that. Yeah, so
To stop it from going down further and blocking off the other.
well, there is really, because of the way the stomach is, the stomach comes around, you know, on an angle. It doesn't sit right up and down. So it's not going to come straight down onto that outlet. But it is going to be able to sit there, and it will stay in that position. And that's where you just make sure, oh, my balloon's sitting in the right spot. I know where it is. And we just educate with that. And when I say that you're doing that, it really is not a problem to do. It's the easiest thing, and it doesn't interfere with your life one bit. I mean, I can vouch for even the fact that when I first had it in, I couldn't run to save myself. You know, I could run maybe across a football field and I'd be gasping at the end of it. And, you know, true to what Felicity said, as far as the team here, you know, a lot of people run, or they just like to exercise as part of a healthy lifestyle. And I got on board with that and started to learn how to run. So within a few months, I was surprised that as a team, we did a fun run called the Neon Run, which was a nighttime thing. And, you know, I ran 5 kilometres without stopping. Now, you know, I was about to become a grandmother. I think I might have been a grandmother for the first time then. And I just thought, gosh, that's amazing that I could actually do something like that. So it's just available, you know. I just felt better. My knees felt better. I'm more active. I was down on the floor with my grandchild and, you know, just doing so many more things. So,
Question, I play a bit of squash and football or soccer and do a bit of running and all that kind of jazz. How would that react inside there?
it doesn't.
Particularly saying football for
Yeah.
soccer.
It
How would
doesn't.
that? It doesn't.
It doesn't. I didn't even feel it. You'd expect that as you're running, you'd be going squish, squish, squish. Didn't feel it. No. The only thing that I couldn't do
So it
was
wasn't
lay on my
like running
stomach.
with a full stomach.
No, not really.
No?
No. If I had eaten maybe just before I ran, possibly.
Mm.
But I didn't know, so I didn't feel like that at all.
What if you play contact sports that wouldn't?
Depends how big a contact
rugby
sport.
league, you know,
Yeah.
getting tackled and that.
I think that the only thing that would be really harmful if you were to get a direct blow to the stomach, and certainly that would be harmful no matter what procedure you had.
So if it lowers the amount of food that you eat, does it have any impact on getting you the correct nutrition?
No, it doesn't. As with any of the procedures, and this is probably you'd probably be able to eat more with the balloon than what you would with any of the other procedures. But that's why we've got the dietitian, because what you would eat, even though it's a small portion, would be in that nutritious range. And I think that a lot of us, and I can vouch when I speak for myself when I say this, is that we overeat and we really don't need that much food. And so what we're used to eating and then think, well, we're going down to eating a smaller amount, it just goes to show that we really don't need that much food. But our nutrition overall is better because our liver's working better, our whole system is working better to take the nutrition from what we're putting in and utilising it properly. Yeah.
What would happen if the thing burst?
So as I said before, when you've got it's coloured blue, so that you can pass.
Would it do any damage?
No, because it's only saline inside. So if it was to leak from the valve, I don't know that there's any recorded literature about it bursting, but there could be a leak. And if there was a leak, then you pass urine that's fluorescent green. And then you'd be going, oh, something's not right, ring the clinic.
And they take it out?
Yes, they would. They get you in and
to take it out?
Yes, very easy to take out. So you just go under a sedation again, they deflate the balloon and they pull it out exactly the same way that they put it in.
If you take like migraine tablets or things, will it impact how long it takes for them to kick in?
It shouldn't, because it still has room to go around the balloon. So your stomach is still there, the gastric acids and all of those things, the digestive enzymes are still all there in your stomach, and it shouldn't have a problem with that.
How much bigger is that thing in your stomach compared to what you just showed us?
It's probably about another 150 mils more than what's in there.
It gets up good size.
Yeah, it's probably about this size. So that size is a bit squishy. It might be just a little bit bigger than that, but more firm.
Okay.
Yeah. Okay. All right. Well, I might move on to the next ones now, and then we will, if you've got any other further questions, I'm going to be here all night and I'm happy to answer anything, and the dietitian and psychologist may be able to answer those as well for you. Is that okay? Okay. So the next procedure that I'll talk about is the gastric band. So the gastric band has been around for many, many years. So even though we've only been, when I say only been in practice compared to some of the other practices overseas, 15 years in Australia is quite a long time for us to be dealing with these. And this was the only thing that was available for people to help for losing weight, for a long-term permanent solution. So the gastric band is put in by keyhole surgery. It's a general anaesthetic. You need to stay at least one night in hospital, usually only one night in hospital. You have 5 small incisions in your abdomen, and the band is placed around the top part of the stomach. So essentially then you're left with a stomach that's a little bit like an hourglass. So the food will go into the top part of the stomach and then it goes down into the bottom part. Digests, goes on as normal. The difference is that you've only got this small part of the stomach where the food will go in and make you feel satisfied because you've got this small part to fill. And then it goes through and is digested as normal. This is what a band looks like in real life. It's attached. It's not put down like that. It's actually opened. So this is locked. Will it get open? So you can see it's put in like this. And then it's threaded through and it's locked into position. And then there's a couple of sutures that are put over the band as well. Okay. This part here that's attached is called a port or reservoir, and that is like this part here. Now the reason for that to be there is because that usually sits in an area on the upper part of the abdomen. Not that you can see it, but if you were to lay down on the examination bed, that the doctor or nurse would be able to palpate that, and they'd be able to insert a needle into that through your skin and into the port, and that would inflate the balloon that's around the inside here. And that in turn makes a little bit tighter around your stomach or a little bit looser. The reason that you have it adjusted to make it a little bit tighter is so that your weight loss can continue.
So does it start at a certain size and then it gets tighter?
Yeah, it starts with no fluid in it usually.
No.
And then there's a lot of swelling because the stomach's actually soft tissue. There's some swelling that will happen. And so you're quite tight, which is why you're on a very special dietary regime of liquids, then onto puree, then onto solid food. Once the swelling goes down, usually by about 6 weeks, and you've already started on your normal diet, that's when you start having adjustments. And they're titrated. So you might start off with maybe 1.5 mils, so very small amounts. And then, 6 weeks later, you might have another one. You might only need 0.5 mil. And you might only need 4 or 5 adjustments throughout a year. You might not need any. I've seen people lose 60 kilos with a band without an adjustment. But the good part about the band is that it is reversible, it's safe, it's not put in with the intention of removing it, but it can be if you need to be. Downtime is quite small, usually back at work in a week or so. As I said, 1 night stay in hospital. In the early phases, the highest risk is infection. Because you've got a foreign body inside and you're going to have a little cut in your abdomen, then you might have an infection. We actually have not had an infection in this practice for, gosh, I can't even remember the last infection that we had when we've done bands. So we've got a very, very low infection rate. It's under 2%. In the long term, the things that can happen with the band are slippage or erosion. Slippage is just where the band, instead of sitting at that level, it slips out of position, or the stomach herniates over the top. Okay. You would need a further surgery to correct that. It's not something usually that happens in the very early stages, but it is something that can happen in the long term. Okay. Again, those percentages of those complications are like 2%. They're very low. A lady that we'll be sharing with you later has had great success with the band, and she'll be able to tell you just what it's like to have those, to have food and, how she manages. So I'm sure you'll find that a great advantage to listen to what she's got to say. Yes?
The longer you have that in, the harder it would be to get it out though, if you didn't want it anymore.
Not necessarily. There are, obviously, with anything, there are what they call adhesions, which is like scar tissue that can come around it. But you would always get the experienced doctor to be able to take it out, because then they would gently remove all of those adhesions and take that out. I haven't ever seen any problems with people getting it out. They're usually pretty good. But most people don't want them out. Most people don't want them out because once they've got them there, they want to make sure that they're, it's their best friend. They don't want to get rid of it. So, if you were to say to somebody, oh, well, we'll just take that out now, I'm sure most of them would go, oh, no, you don't. You don't touch my band, because they're used to living with it and they know exactly what it is that they can do and what they can't do. There are certain foods that they've got to be careful of. And there's also times where they have to, make sure that their nutrition is adequate. And having the band too loose, enabling you to eat a lot, is just as detrimental, but having a band too tight, where you can't eat enough, can be just as detrimental. And that's one thing that if you're going to have a band, we would suggest that you make sure that you have it in what's called the green zone, so that you actually eat a good amount of nutritious food, that you're not hungry straight away afterwards, but you're also able to eat a small quantity of food. If you were, for instance, eating things that are yogurts and milkshakes and ice creams and dry crackers because you can't fit nutritional food in, that would alert us to say that your band's too tight and you need to have that, you need to have it adjusted, because it can be just as detrimental. Okay, I know it sounds weird, but it really can. Easy to get the high calorie foods in. Okay. Any other questions about the band before we move on to the sleeve? Okay, so let's talk about the sleeve. So the sleeve has been around for quite a few years now, a number of years, and it started off as the initial procedure to a two-part procedure. So it wasn't always just a primary procedure to have weight loss surgery. And the reason that it came about was because there were people who needed to lose some weight before they went on to their main weight loss surgery. And that sounds a little bit weird, but that's the way it was. And they thought that they'd do this and take away part of their stomach, and then later on they'd come back and have this second procedure done. And what they found is that the weight loss was so good after they'd actually had this stomach removed that they thought, well, if we made the stomach just a little bit smaller, then we could use that and offer it as a primary procedure. And there evolved the sleeve. So the sleeve gastrectomy has been around for quite some time. It's done again by keyhole surgery. When doctor goes in, he's got these fantastic instruments that he can cut and staple and seal all at once, and it's amazingly clever what they do. But in any case, you've got this scene of the stomach here, and this part of the stomach is totally removed. So instead of having the restriction this way, as you do with the band, you've got the restriction this way. So it's still a restrictive procedure, not a malabsorptive procedure. Okay? The difference with that means that it's restricting the amount that you can eat, but it's not making you malabsorptive, so you are able to still absorb a lot of your nutrition. This procedure is done by general anaesthetic, still done by keyhole surgery, and it is 2 nights stay in hospital. The recovery is usually around about a week or just over a week, depending on the type of work you do. You might be able to go back to work in a week, or it might be just that little bit longer. Complications with a sleeve are more in the early stages. There are 3 things that doctor will talk to you about, and those are bleeding obviously from one of the areas here, leak, so that if that area is not sealed off, it can leak, and stricture, so that the sleeve can sometimes go into a stricture. Those percentage rates are 1%. 1% of all the procedures that give that percentage rate of risks. So it's pretty low, pretty low. The advantage obviously is the weight loss, as with all of the procedures. The sleeve seems to be one where people lose the weight faster in the beginning. Okay.
Is there any chance of the stomach stretching to accommodate more food?
In the long term? In the long term, yes, to be honest with you, but stretching back to what it was beforehand, no, because you've actually had 2/3 of your stomach resected, so you're not going to go back to what you were before. But if you're going to push it, and certainly it can increase, but I think you'll find by the testimonies of people here tonight that that's, they can't even imagine that can happen. But as with anything, as with any of the procedures or life in general, if we choose to put in the wrong things into our mouth, including with the sleeve, even though you can't fit a lot in, you might be able to fit in high-calorie foods or high-calorie fluids. And if you're going to choose to do that and do that on a regular basis, you're going to get a lot more calories in. And so that's not going to be helpful to your weight loss in the long run. We've actually seen the cessation of and you wouldn't call it cure because it's not really a cure, but certainly we've seen people come off their diabetic medication literally less than a week after they've had surgery. So that's so encouraging in any case. But it's certainly any of the procedures that when you lose the weight, if you're a diabetic or high blood pressure, medication comes down, the illnesses get better. And that's what it's about. It's about health. Do you have any other questions at the moment? Okay. Well, I might pass you back over to Felicity now. Thank you so much for your time. And with sure any other questions, please ask later. Thank you.
That was a fantastic overview of all of the procedures. I just want to actually thank Holly, Amanda, Beck, and Amanda, did I mention? All the questions that have been firing away throughout online. I really appreciate your questions. I hope I've answered them well enough for you. And Robert, I'm really glad you joined tonight. So thanks for joining us online. One of the things, I know that there's been some questions regarding the balloon, and actually this is the same for any procedure. One of the critical things that we focus on here is the value of working with a team. Any of the procedures is only going to give you your long-term opportunity to reach your goals and outcomes if you commit to not just working with your procedure or whatever it might be, device, but also working with the team, because that's where you're really, really going to get the benefit. And the long-term outcomes come from your commitment to engage with the team that we offer for you to work with over time, and especially in that first 12 months. And that, I guess, with the balloon is really, really critical. You know, the balloon's in place for 6 months. I guess that's kind of the honeymoon phase. That's when you're losing weight, everything's going well. But when it comes out, if you want to really establish habits that are going to become habits for life, you know, the research does say that if you work with our team for 12 months, we know that we can impact change that will hopefully become lifelong, and do our best to help cement those new patterns of behaviour and get them to stick for the rest of your life. And that's, you know, where the critical factor comes in. It's not just about the device, and it's not just about the procedure. And the same goes with the band and the sleeve. You really need to work with the team to establish some new lifelong you know, patterns of behaviour. And I sort of draw your attention back to that film at the beginning. It's one thing for us to turn you into a much thinner person, but working with you to develop and work and turn you into a really healthy person, that takes a lot more time, effort, and amazing resources to work with you to achieve those goals. So just something to think about, and you know, you'll see that the theme of what you'll hear from all of us is all about working with your team members and getting to know them and making the most of that opportunity. All right, so at this point I'd like to introduce you to our psychologist team member, Warren. Please make Warren welcome to tell you all about his role and how he's going to help you along the journey. Thank you.
Thanks, everybody. I've been at the practice probably about 9 years or so.
Hey, Warren.
How are you? I've been in the practice about 9 years now, and been very fortunate to work with probably somewhere between 2,500 and 3,000 patients over those years. And I think it's probably fair to say that I get to learn a lot from the patients I work with, probably learn more from them about psychology-related constructs than I've ever learned in the university class, for that matter. So perhaps I should tell you how I initially got involved in this environment first, and you'll probably have more of an understanding as to my role, because there's lots of parallels between what I envision doing and what I do at the moment. So 99% of my work is pretty much in this particular field. But I originally started out with a very strong interest in sports psychology because of my background in sports, and spent many years in America. And one of the things that really sort of interested me in sort of all those years ago, talking probably close to 15, 20 years ago, was the impact of lifestyle on an athlete's performance. So when we look at all the steps that the traditional steps to complete performance, for example, we look at tactical things, we look at technical things, so putting in the sports environment, the technical, mental, emotional, physical, and you've also got lifestyle. And lifestyle tends to be the one that generally, when you put all the other things aside, most people, when they get to a certain level in their sport, they tend to have those other things pretty much down packed. But some of the psychological things and emotional things tend to be ongoing challenges, but lifestyle itself can be a catalyst for very poor performance, particularly poor lifestyle. And that's pretty much how I got involved in weight loss surgery, because it's very much the same thing. But you've set yourself a goal to lose weight, very much like a tennis player sets himself a goal to win a tennis tournament. Doesn't matter if it's Wimbledon or the local community tournament. But ultimately, there are things that have the potential to interfere and impact your performance, and therefore they will impact the results as well to a large degree. So we have to focus on lifestyle. And part of focusing on lifestyle is helping you have a change of attitude towards your lifestyle. And that's not always easy to do when you've grown up living a certain way, following certain rules, maintaining certain habits that you believed have a justified or warranted journey, so to speak. So there's lots of beliefs that you will hold as a result of childhood, for example. When you get to a certain point as an adult. And for many people, we still hold those beliefs, and they're very much habits quite difficult to break. So again, going back to my role, it's really about supporting you through this process and knowing full well that just like a sports person, there are many things that could potentially interfere in your journey. Okay, so I've got a question for you. Right. If we took a tennis player, for example, that has all the attributes of a top professional, perhaps as a professional, took all the things that could potentially impact them, for example, like lifestyle, like technical side of what they do, the tactical side of what they do, physical fitness and strength, the emotional resistance and emotional control that they exhibit, and also the psychological preparation that they put into it. Okay, when you put all those things aside, what is one thing that could potentially interfere with that person having all those things already and under control? What is one thing that could potentially interfere with that person's ability to be their best or get to a certain point and win a certain tournament and achieve a certain goal? Can anybody think?
What they think. The belief in money.
What they think?
The lifestyle they were talking about.
Well, not necessarily lifestyle, but what are some of the other things? So if you're on your journey and you're trying to win something, say it's a tournament, or you're preparing yourself for a tournament, and you've got all these things that you're working on, but you've got them already under control. So I'm talking about all the things that I've spoken about, lifestyle, tactical. What are some of the things that could potentially interfere with that person?
Injury.
The discipline. Or
Discipline?
Mindset. Mindset.
Mindset, anything else?
Health.
Health, yeah. Okay, so what about something like stress in a relationship, family relationship at home, or a death in the family? Okay, all right. So there's a perfect example. It's something that's completely unrelated, right, to that person's preparation or mindset in terms of what they have to get control of and what they have to work on. They've got all these little things that they've got to work on. They've got these people around them, just like you're going to have people around you here. Okay, they've got physiotherapists, and they've got fitness coaches and strength coaches, and they've got perhaps a psychologist to work with them on preparation. But there's a lot of things that happen that are unexpected, that aren't planned, and there isn't anybody sitting there waiting to help you when that problem arises. So whether it's a death in the family, stress in the relationship, change in financial situation, change in your job, all of these things have the potential to derail you and put your mind elsewhere and let those old habits sit around and stay stagnant, and you don't get a chance to evolve. Okay, that's kind of my role. All right, so in saying that, what we typically do is we allow you to come in and spend 45 minutes to an hour with me before surgery, so that we can talk a little bit about what's got you to this point, who you are, what is your identity in this world, who do you belong to, who do you live with, what do these people mean to you in your life, what job do you do, what are your goals, what are you trying to achieve, and from that I'm able to basically put together a case in the form of a report that I can refer to when I see you again. And I typically see you again 6 weeks after surgery, 6 months after surgery, and 12 months after surgery. So those are your generically scheduled visits. Okay? And that's because I want to see you. Whether you like it or not, I do want to see you, because I want to make sure that everything is going okay and nothing is interfering with your decision to achieve your goal. So I suppose one way of putting it is I want to help you try and get the best results you can from this procedure. It doesn't matter if it's a balloon, a band, or a sleeve, but when you start talking about procedures that are permanent and not reversible, like a sleeve, it is very, very important for you to actually try and get the best results you possibly can from surgery. Because even though you may have one or two options after this, we would prefer you to just get the first one right. Okay. So with those generic visits, those are opportunities where we'll schedule those visits for you. We want to see you and bring you in and have a chat. But if something happens in between that, say between months 0 to 3, or between 3 to 6, 6 to 9, then you have the opportunity to come back. So when Felicity talks about the support structures that are in place here, because these are support structures that we haven't just gone up and said, okay, well, this is what we're going to do. We've done this based on what we've been doing for the last 10, 15 years in this clinic. And as we know what works and we know what patients need, because we know what journey they're about to go on. So we know what you are likely to expect. So in our consultation, I'm also going to give you a picture of what you can expect afterwards, so that nothing comes as a great surprise. Okay. And then we've got an opportunity to address all those other issues if they arise, and of course deal with any frustrations, deal with any upcoming challenges, or deal with any unexpected circumstances. So to keep you focused and keep you on track. Okay. Does anybody have a question for me? Besides asking if I ever had a child. I had a patient ask that.
Warren, I'd just like to say thank you for yesterday we spoke and how liberating it was that you explained how I was in this cycle of eating, from the emotional to the guilt to the making bad choices and just why it started, and it just feels, like I said, liberating now. I'm really glad we had that talk.
I'm really glad we did go that
Oh, that's awesome.
Oh, just have a hug for that, Julie. That was beautiful.
Okay, anything I can help with, I mean, that's my role. So hopefully that's just the start of it. So it's put things in place and have what you need to get done, and just I suppose for you, I suppose it's also nice to know that you can come back here. You can talk to us anytime. It doesn't matter if it's 6 weeks down the track or 6 years down the track. We have patients that have been with us for 15 years and still come back and see us.
Yeah.
Okay, so this is kind of your home, and it's kind of a place that you, where you come and you deal with something. And I just want to, just before I finish, I'll just tell you a little bit about, the potential for relationships and the impact of relationships. If you've got a partner, and sometimes that partner or that person in the family, can mean well in terms of what they're trying to help you with, and perhaps try and be that supporting person next to you. But they also may not know what you're going through, and rather than put more stress on that relationship and let that evolve into something that's creating stress in the environment or stress in the household, just put it aside and come here and talk to us, because this is something where you have to devise or separate personal support versus clinical support, and you've got it. So I'm glad I could help, and I'm sure we'll enjoy working with you in the future. So thanks.
Thank you. That's great feedback, Julie. And the one thing I will say, if you entered into that, that space where you've allowed yourself to be so open and to get to know your team psychologist, you're going to get a great, your future's going to be awesome. So congratulations to you for taking that on board. I think that's brilliant. And that's what we love to see. Really proud of you. That's great. Is everyone comfortable? Is it a bit too cold in here? Do we need to, I'm looking at people thinking you're just starting to wrap up in blankets. Do you think you'd be able to just turn the aircon just up for me? Yeah, awesome. Thank you so much. Just a couple of the things that Warren was talking about in terms of, research that we've done that has supported our development of programs to manage and get the best results out of patients at that 12-month mark. Carol, many years ago, was involved in one of the world first research opportunities to investigate, does follow-up attendance equate to better weight loss results in patients? And with a dietitian, she presented that to an international meeting in the US, one of the top international bariatric meetings, the American Society for Metabolic and Bariatric Surgery in Boston in about 2004. And since then, that research has actually been developed and extended. So we know from research that's been conducted at this clinic that this is a really powerful opportunity to work with the team because it gets results. So just so that you know, we're really proud to be part of world first research. And we do also get involved in other areas of clinical research. We have actually conducted a clinical trial in this clinic for new device technology, something that we hope to be able to do in the future. You know, we always see ourselves as wanting to be at the cutting edge of where bariatric surgery is going in the future as a dedicated bariatric practice. So that was a fantastic opportunity for us as a clinic, and one of our team members who's not here tonight, Michelle Scott, is our clinical nurse. So she actually was the trial coordinator for that. But she also has a significant role in our practice looking after all of the bariatric patients, and she does all of our gastric banding adjustments. I had a question about adjustments online earlier. So we do have a nurse who's very proficient and an absolute expert at performing gastric banding adjustments, who's here in the clinic looking after just the adjustments. In your bags that you've got tonight, there's all sorts of information in there. I encourage you to go through it when you've got time. There's a magazine in there with articles and stories about our patients. Take your time to go through that at some stage. You'll also see in there, this is just one little piece of information that I've added into that bag tonight. And I like this for a few reasons. And I thought I'd actually just show it to you and mention it before we call up our dietitian. So if you think the dietitian is going to talk to you about increasing your fruit and veggies and having 5 servings a day, there's really good justification for that on this piece of paper right here, that it increases your longevity by 6 years. So that's a pretty good reason for eating your fruit and veggies, isn't it? It also says you can have a glass of red wine every day, that's going to be really good for you. But if you drink more, that's bad. It's probably stuff that you already know, but it's nice to actually see this information in data presented like this that gives you a little bit more clarification on things that we know are good for us, but we're not really always very good at practicing. So basically, don't drink too much, don't watch too much TV, don't eat too much red meat, and definitely don't smoke. So yeah, really interesting piece of information. I hope you enjoy reading that a little bit later when you have a chance. Any questions for me at this stage of the evening? No? Excellent. All right, I'd now like to introduce to you our dietitian team member. Erin's an accredited practicing dietitian and is a wealth of knowledge. Please make her welcome.
Hello. Good evening, everybody, and everybody who's also at home watching. Thank you so much for coming. My name's Erin, and I'm actually relatively new to the Weight Loss Solutions Australia team. I've been here for about 3 weeks now, and I guess the reason I'm here is because I love food, basically. I think food is the most fascinating thing on the planet. Ever since I was little, I've been always fascinated with what food actually does for our body, what food actually does for our health, how we can either be made sick or be made healthy with it. The whole thing to me is just fascinating, and I love it. And one of the reasons I really wanted to work here and be a part of this team is because I truly believe that food is the greatest friend that we have. I mean, we can't live without it. We actually can't live without it. We have to eat. And I think, you know, a lot of people who come through this door, food is not their friend. Anyone who's sitting here right now tonight, can you honestly put your hand up and say food is your friend at this stage where you're at right now? Yes, we got one. Great, yay, good. And see, that's really one of the fundamental things that that me as a dietitian, as part of this team, I want you to walk out of that door saying, food is my friend. I genuinely enjoy food, and I genuinely enjoy what it does for me in my life. That's one of the main things that we will work on together as part of the program, because really, how sad to not have food as your friend. So, so that's probably the main, I guess, motivation for me to be part of this team here. It was a little bit like a dream come true when I started here. It's been fantastic so far. So I guess the thing I should mention first is that anyone who's sort of coming to this seminar, having a watch online, or has considered weight loss, either surgery or a non-surgical option such as the balloon, is that you've come to this point because weight loss comes down to a lot of things. Weight gain comes down to a lot of factors, like Warren just mentioned as well. And everyone sitting in this room tonight and watching along at home is really here because, you know what, it's not like you get told over and over and over again. It is not as simple as calories in versus calories out. It is not always as simple as eat less and the weight will come off. Because if that were true, then we wouldn't be, I guess, coming along to the seminar, learning about these options. And there's nothing wrong with that. That's life. And it's one of those things that I think weight loss surgery is not always very well understood. And it's a really great thing that everybody's here tonight to learn a little bit more about it. So in a dietetics consult, one of the things that we work really, really hard on is we have a look at, okay, what are the other factors? Other than maybe dietary choices, what are the other factors that lead to weight gain? What are our hormones doing? What's our blood chemistry doing? What are our exercise levels like? What are our stress levels like? There are so many different things that are going to influence not only our weight, but our health and our outlook on ourselves as well. And that's a really, really important part of I guess, coming in and having this team environment here, is that all of us really do focus on that. What we would do probably to start off with from a dietetics point of view is I need to know what your nutrition is actually like. And so what I will do is, go through with you, I guess, what eating behaviors, what eating patterns we've had. But the main thing that I'm looking at is what your blood test tells me. Because it tells me a lot, it doesn't lie. And so that's I guess one of the benefits of having a dietitian, rather than looking into a lot of information we can get online. There's a lot of information that's always popping up at us in magazines and on Facebook. The whole world of nutrition is really taking off at the moment, and it can actually be quite confusing. It confuses me sometimes. I find diets that I've never heard of before, and I go, sorry, what's that? Clients and patients here tell me of diets and things that they've tried that I've actually not heard of. So it is really, really taking off. And sifting through that information, filtering through it and going, what do I pay attention to? What do I not pay attention to? Should I be paleo? Should I be a vegan? Should I be on the Atkins diet? And usually somebody who comes through our door has possibly tried all three of those things. It can be very difficult to understand what exactly you need for your own body and for everything that's going on in your own life. And so that's what we really work on. We go, okay, where are you exactly now with your nutrition, with everything else that sort of ripples around you? Like Warren said, we've got lots of factors, and where do we want to be, and what are our goals? And that's what we work on together. So you get a fair few blood tests when you are a part of this clinic here, and that's because I really want to make sure that whichever option we choose, whether it is a balloon or a band or a sleeve, the main thing is that we are getting that nutrition in. Probably what I should mention is that I have not really had so much to do with the sleeve until I started here. Lots to do with stomach surgeries and digestive surgeries, but not as much to do with the sleeve. And I'm learning so much. I'm learning so much from the patients who come in here. One of my favorite things about, I guess, not only the sleeve, but your band and the balloon as options as well, is that it forces you to view food as nutrition and fuel and something that is actually a positive aspect of life. Because typically, especially really after a sleeve, which is a much more involved procedure, as what Carol's explained to you, it's more of a recovery process, but it can be very difficult in the early stages of some of these procedures when you go from having, I guess, your full stomach capacity to having something that maybe fits about this much in it for a little while. So getting your nutrition in, getting what you actually need can actually be a challenge. I like challenges. This is a challenge for me, because when somebody has a sleeve done, really what can be quite difficult in those early phases is actually getting in enough fluid, enough protein, enough general nutrition. We can do it. We can definitely do it. But it basically doesn't leave a lot of room for eating foods that I guess aren't really nourishing our body. And tonight what we're really wanting to focus on is how do we get our energy back? How do we pick ourselves up? How do we, I guess, get to a stage where life doesn't feel hard or draining? And a lot of that comes with a change in our nutrition. A lot of that comes with really sort of focusing and shifting our mindset to, okay, food is something that I've got to put inside my body every single day. What is it doing for me? And I guess at the start, people don't quite sort of think, oh, I don't think I'll ever see food like that. I'll always only want chocolate and I'm never going to want to eat my vegetables. But really one of the great things that I'm seeing, and that I guess this clinic has seen for so long, is that when you do have one of these procedures done, the balloon band, probably especially the sleeve, is that people really become much more interested in food and interested in what that's actually doing for them. Especially when we say, you know, somebody's been a bit low in their vitamin D or possibly a bit low in a certain aspect of their nutrition. And when they pick it up just by changing their eating habits, or if somebody, you know, is a diabetic, has been on insulin or diabetes medication for so long, and then their doctor says to them, you know what, we can drop that medication down, or we can get rid of a medication altogether, like a cholesterol medication. And it's those things that, you know, can become so medical, and we don't always stop and think, actually, I'm in full control of that, and that's my food. That's what I choose to put into my body. And that's something that, yes, it can take time, but it's a really wonderful positive of having one of these options. You know, looking at one of these options. All three of these procedures help us to do that. All three of these procedures teach us so much about the portion of food that we need, the types of food that we need. Who in this room has been on a diet of any description for any length of time? Please put your hands up so the people at home can see you. Yes, yes. What did you learn? Do we learn much? What did you learn? Can somebody yell out one of the ones that we've tried? If you're happy to.
Portion sizes are a good one.
Portion sizes. Okay, looking at portion sizes. Good. Okay. All right. Fantastic. Has anyone had, I guess, any success with any other, I guess, you know, diets or temporary cleanses, 12-week body challenges? The list is honestly endless, and it's expanding.
Liver cleansing diet.
Jenny Craig and Weight Watchers.
Jenny Craig and
top two.
Yeah. Okay. All right. So now, the reason I'm bringing this up isn't to necessarily bash any other form of weight loss or any other company. That's not what I'm intending to do. But what we generally tend to find is that people who come through these doors are much more of an expert on different types of diets than I am, because they've tried them all. And typically what we learn on a 12-week body challenge, or on a shake type diet, or something that's relatively short term, is we learn to follow the rules. So I ate this then, and then I have this, and then I have this, and then I do this. And then it ends. And we haven't actually learned the tools to go on and maintain that weight loss or to live a healthy life. Sometimes we do. Sometimes we can actually do a program that's fairly inclusive, and we do learn a lot, and then the program ends, and then all of that support is gone, and then all of that accountability is gone. And so really what we focus on here is that, okay, you know, we're going to do this. Yes, we're going to have a procedure, but what we really want for everybody to learn is about their nutrition. What is going to take you forward? So we don't want to sort of go, okay, yes, you've had the procedure, weight loss is going to happen, but there you go, off you go, bye-bye. What we do know is that for the people who stay in contact with us, the people who are continuously learning and asking the questions that they think, oh, this might be a silly question and I should know the answer to this, the people who do ask those silly questions, the people who do remain engaged, are the ones who learn the most and who have the most success long term. And really that's what this clinic, that's what our team is about. We want you to be able to maintain your health, your happiness and your weight loss long term. And we want to be able to help you with all the tools that you need in order to do that. So these procedures are your tools. But everything else that you learn and that you develop, that's all you. You know, we can help you, but you're the ones who are going to take as most out of this as what you really want to. And because this is such a big commitment to yourself, that's where we see people go, you know what, I'm going to take this as far as I possibly can. And the people who we do see regularly over that 12-month period, and you know, and even afterwards, are the people who really get a handle on it. They go, you know what, no, I've taken control of my life now and I've got that back. So does anybody have any questions at this point?
Erin, I've actually got a question from a lady online.
Yes.
It's from Holly, and her question is, if you can't have lots of little meals due to work, how are we supposed to keep our nutritional intake at the correct level? It's a
Okay.
good question.
Yeah, that's a fantastic question. And we get so many people, lots of nurses, lots of truck drivers, lots of shift workers. And that lifestyle can sometimes be what has led to weight gain to begin with. Now, if you have a job, and a lot of people do, where it's not exactly practical for you to say, I'll be back in 10 minutes, I just need to go and have my very small snack. It doesn't work for everyone in every occupation. Now, if you are finding, okay, I've got long shifts or I'm on my feet or I can't necessarily stop, what we do is we work with you and we work around that. So we work around when your shifts are, when your off days are. What are some practical foods or snacks that we can keep on us at all times? How are ways that we can get fluids in particular? Where can we station some small drink bottles around the place? And then we look at, okay, if we can't maintain, I guess, our 3 meals and our 2 snacks, I'm sort of talking typically for somebody who's had a sleeve, then we look at, okay, all right, we're going to have to look at how we're going to get that nutrition into one of the meals where you know you can sit down. And I guess it's taking that responsibility and going, okay, yes, I know I'm tired and I know that I've had a long day at work, but I'm going to be prepared. So we do a lot of education, a lot of talking around where I guess we find our weak moments might be, like 3 o'clock in the afternoon for some people, or some people on night shift, it might be finishing at 4 o'clock in the morning when you want a Coke or a piece of chocolate. We've got a plan. We've always got a backup plan, and then we've got a backup plan for the backup plan. And so that's something that we focus on a lot at this clinic, is that we know that everybody doesn't have a standard 9-to-5 job. So we can always plan around that. But but what that is teamwork between you and I. It's teamwork, I guess, with you and the whole team. And it's something that if you're committed to making those plans, to making those changes, then we can always find a way to get nutrition in. But I just look at that. It's always the way.
Any more questions? You're welcome to fire away.
If there's anything, I guess, before or after the surgery that people are concerned about or have any questions about, I will be here for the rest of the night. But if I've touched on most things, I think with one of the questions, you down the back said, oh, am I going to get all my nutrition even though I've got something sitting in my stomach or part of my stomach removed? And what I'll just say really quickly is that yes, you can. Otherwise, we wouldn't be doing these procedures. If it was going to affect you actually being able to absorb any nutrition, wouldn't be something a dietitian would be very happy to be a part of. Sometimes for people, it can take a little bit longer for some of their enzymes to come back to full capacity, but I've never met anybody who didn't have that. So it's a bit of patience in the beginning, but definitely you'll be able to maintain your nutrition, but you'll just be sort of shifting your focus and looking at food in a different way than what you did before. Yes?
I'm not on a commission, for a start, okay. But I was talking to Erin yesterday, and the amount of information you gave was amazing. And yeah, even he put you through your paces and he came out
He did.
and you're wonderful.
Yeah. Had a guy who knows a lot about protein come at me. Had to be prepared. But that's fantastic that you've got that support.
I'm really glad that you gave me all in notes so I could go back and look at it, because as you said, it was just overwhelming, the amount of information.
Yeah. And I can talk a lot.
Yeah.
But thank you so much for that, and thank you for being a part of tonight. It's always really good to get that kind of feedback. But we want to give you as much as we possibly can, as much information as we possibly can. That's what we're about here. So I'm really glad that you were happy with that.
It's good to talk to someone that knows the language.
Oh, yeah, always. All right, thank you so much, everyone.
Thank you. That's awesome, Julie. I might pay you to come next time.
Yeah.
I'll be skinny next time.
Just a couple of stories I'd like to share. We talked about exercise earlier. You would be amazed at some of the things that our patients have achieved over the years. And when I look back and think about exercise and results, when you talk to a group like this, I'm always a little bit reluctant, because I think, that's kind of a dirty word to talk about exercise. It's not something that you're generally comfortable with. But some of the things that our patients have achieved include a 53-year-old lady who ran 10Ks as part of the Noosa Triathlon, one of our male patients who ended up becoming an Ironman triathlete, not just doing triathlon, but Ironman distances. And, this is from a guy who started out his journey being on the sidelines and coaching his kids soccer, but not being able to participate. And to see that kind of conversion in our patients and see them actively participating in high-level sport and achieving such incredible things is a phenomenal situation to observe, and to just remind ourselves that anything's possible. You just don't know your own limitations until you give it a go. We've got an Albira patient of ours who has won a gold medal at the Surf Life-Saving Masters Games in France last year. So that was one of his goals. He wanted to get back to running. So he set his sights on that and went and won an event overseas. So, these are some of the stories and the journeys that are not uncommon, where they're actually commonplace, and we love that we get to share those experiences with patients. You would be absolutely amazed. And we hope that eventually we'll see more of you come on board and be part of the events that we run. And we do like to engage with you in a whole different host of opportunities to educate, inform, and have fun. Last week we actually had a dinner, and it was a dinner that was inspired by a friend and a colleague, a surgeon who used to be based in Brisbane many years ago, used to take his patients out regularly for dinner. And that was all about not just community and getting together and sharing stories, but also all about learning what it's like to be socially active after surgery and what it's like to order off the menu. I have to admit that I did make a fatal mistake last week, that I chose burgers on the menu and didn't actually necessarily go down that well. So next time I'll probably leave the burgers off the menu, but the idea of doing that was actually about seeing that you can actually have a burger in a healthy way, that there's different ways of doing things, and it was about the learning experience. But yeah, I think I'll change the menu. But the concept's great, and we had patients coming back to an event like that who we hadn't seen for a couple of years. So it does reconnect people. So there's lots of opportunities where we like to get together and involve you in so many different aspects of improved lifestyle opportunities. All right. So I'd now like to introduce you to start with the patients. So I'll get to him later. Sorry, I'm just being sure. I forgot to talk about something, but I'll get there. All right, our patients who we'd like to introduce you to tonight. First of all, Tammy, who's now working here. I've known for a number of years, and first of all as a patient. And I'll just share one thing with you that hopefully she will leave out of her presentation. But once upon a time, quite a few years ago, we actually ran side by side and did 10Ks at the Gold Coast Marathon. So that was a huge and wonderful moment in my memory of time that I've spent with Tammy, and now getting to share the time with her as a colleague in our practice. But tonight she's going to come and share with you her experience of having had a gastric band. Please make Tammy welcome. I'll say hi to everybody here and everybody on the web.
My name is Tammy, and almost 11 years ago, it wasn't in this room, it was out at John Flynn. I met Felicity, I met Carol and other team members there when I was 153 kilos. I was at a point in my life where I was so morbidly obese, my life felt like it was just going down the tube. I couldn't move, had no energy. I ended up having a small angina attack. I went to see my doctor, 2 doctors actually, to ask to get a referral to come and get lap banding surgery. They didn't want to hear about it. They didn't want to give me a referral. So I found a doctor who was supportive. And he actually said to me, and I was 35 at the time, 2 young children, not that young, 2 young children, and he told me if I didn't do something about my weight, I would be dead in 5 years. Now, the reason I am saying this, and I know it sounds very graphic, my weight gain was not through not normal avenues, because as a child, always growing up, I never had a weight issue. I was thin, ran around in my early 20s, had children, put on a bit of weight, but I could lose it. I actually injured my neck in my work environment. That took me out of action for 12 months. And as lovely Erin was saying, we've all been on diets. The most devastating diet that I went on, my husband supported me. My husband has always supported me, loved me, whether I was thin, whether I was big. He was just concerned that I wasn't going to be around to share the rest of our lives together. Anyway, we did the lovely liver cleansing diet. And he lost the expected 10 kilos. And I put on the unexpected 10 kilos. And at that stage, I was 134 kilos. And I didn't need that. And I was just mortified. And I just crumpled into a heap and I cried. And I came across a wonderful ad in a newspaper to attend a weight loss information seminar. And that was in 2004. And that was the first time I attended it. And the biggest thing that I took away from that was when you're very overweight and seriously overweight, it's whether it's intentional, whether it's not intentional, people do ostracize you. You become very isolated, so you tend to not want to go out as much. You don't want to just, you tend to withdraw from people. And the best thing I took away from the first time I went to the seminar was the fact that I was with people who were looking for the same result. They weren't going to be sitting next to me looking at me going, oh, gee, you're a big girl. Nobody was interested. All they were interested was improving their lives. The second time I went to the seminar, I was with my husband and a guest was speaking and he held up a pair of pants that he used to wear, and my husband was blown away at the size of these pants that this man used to wear. And I knew right then and there that getting this procedure for myself was going to work. I personally needed a handbrake. I had good, what I thought, concept of food, but I couldn't move, I couldn't exercise. And as Felicity's saying, it's not how you start off when you're losing weight. You're going through the process of having your surgery and you're coming here and you're having your appointments. Your whole point isn't, I'm going to run 10 Ks. The whole point is I want to get healthy. And it naturally happens that the more the weight comes off, the more you're working with people that their interest is to support you, you start feeling embraced. You don't feel isolated. You've got to do your part. Your surgery will do its part. But you need to engage with who you're working with, to be honest. But then as the weight starts to come off, your energy levels rise. You want to go out. First thing I loved doing was just buying clothing. But I realised that, hang on a minute, it's actually going to start costing me a lot of money, so I better slow down on buying the clothes because every few months I was going down a size. It had taken me 2 years to get down and lose 75 kilos. I've maintained that for almost 11 years. The clothes, I was one of a group of like-minded banded people who used to have clothes swaps. They'd all meet every few months, all sit around, just socialise, chat, talk about issues that you would get the same support here, but this was solely for the point of it was expensive buying clothing all the time. So they'd swap clothes. Here, have this size, you could take that size. And I was able to connect with people that could understand. My husband could understand and my children understood. But I felt very much in control. And the moment I woke up out of my surgery, I just knew it didn't matter how long it took. If I worked with this team, if I did my part, I would get to where I wanted to be. I never worried about the scales, even though we do weigh you here. The scales aren't your friend. They're not an indicator of truly what is happening. It's just a marker. So I knew that when I was eating correctly, looking after myself, attending all my appointments, and not having that fear of if I've had a bad month, oh well, I'm not going to have my appointment because I've failed. Because sometimes that mentality creeps in and you think, oh, I've let the team down, or I've done something wrong, so I don't want to be judged by that. And that comes from being overweight. You're always feeling that somebody's judging you, somebody's making a comment, somebody's, it's always a negative response, and half the time it isn't. Half the time it's you. So I knew that when I did have a bad month, or there was a time there that I just felt like, I just don't seem to be losing the weight. All I've lost is 20 kilos. And people would go, 20 kilos, that's fantastic. And my husband took us into Bunnings one day and he said, oh, just come over here, we need to get some potting mix. And he picked up this 20-kilo bag of potting mix. He said, I can just hold that for a second, I need to get something else. I went, oh man, that's heavy. And he said, well, that's how much you've lost. The light went on and I thought, wow, 20 kilos, even though I had it felt like 1 million more to go, it cemented something in my mind that said, wow, this is really happening. And as Felicity was sharing about the exercise, we have events here. Doesn't mean that if you can't attend, there's something you're doing wrong. We're just wanting to encourage that you engage with one another. You will find as more the weight is coming off, that you're getting a grip on how to eat properly, getting the correct nutrition in, you'll find that your energy levels go through the roof. All I ever did when I was big was sleep. And I loved cooking. And I loved trying to be out in the garden, but I found it difficult. I've got to the point I couldn't even tie my shoes up because I couldn't bend over. And, there were just all these little things. I'd look at a chair like that and I'd go, I'm not going to sit in the chair with arms because I'm not going to fit. It was always, you had this mentality, this prisoner mentality, no matter where you went when you were big, that's all you thought about. Your mobility, people looking at me. Now, it's like you've got a get out of jail free card now. You don't have those issues in your head anymore where you're walking around and you're thinking, oh, how am I going to fit in the plane seat? I'm going to have to get a seatbelt extender and all those sorts of embarrassing situations. Oh, I can't go on this ride with my kids because I can't fit in the seat. Or, you lose a lot out of your life because being overweight becomes your prison. And coming from my point of view, because it's only my point of view and it's my story I'm sharing with you, was that always inside of this big fat body, this 153-kilo woman, this was how I felt. This was the person that I was inside. And when I had that surgery, it was literally like somebody undid the zip on a fat suit and away I went. And this is the best opportunity to come to events like this. It's great to be on the web participating. I'm always available on email, phone call, Facebook we have. Just available if you've got a little question that you want to ask, or you just want, somebody to say, hey, it's all right, we care. We're all here for you. We all understand. Everybody does have different journeys that they've gone through, but we're all here for the same thing. So I'm going to leave it open to any of you that if you have any questions, if you'd like me to answer, or maybe I've answered them all.
No questions for now. Tammy,
I'm sorry for making you cry.
I just felt everything you said.
Thank you. You're going to make me cry.
That was beautiful. Thank you so much. I just have to say, 75 kilos, that's a huge number. Do we actually think about and conceptualize what 75 kilos looks like? That is phenomenal. And I mean, Tammy says that so casually, I've lost 75 kilos, but just to really get the magnitude and the volume, and what an incredible achievement. And, I think with anybody that presents their own personal story or testimony, with the band, it's really a lot about how you treat your band and how you work with it. And I have to say that's a massive big congratulations to Tammy, because she's worked with her device since 2004, and the maintenance and stability of where she's at now at 2015, I think is I love that. I think it's really special. And also important just to highlight that whilst we might have started with the band, it might have been all that we had to offer once upon a time, it's still a really worthy procedure in the mix of a dedicated bariatric practice that for some patients the band is still ideal. So if it's something you're thinking about, don't discount it. It is a wonderful device, and yeah, really, really proud to see Tammy stand up and share her story tonight. Yeah, and sorry, Tammy just said her band is her friend. That reminds me of another lovely patient who, when she was she had her surgery quite young. Her mum also had a band. And I just said to her one day, wow, you look amazing. And her response, I asked her what she was doing, and her response was, I'm treating my band well, And I just think a lot of it is about attitude. It's the attitude that you come into it with. So yeah. All right. I have another very special guest. If you've got time to actually stay with us for one more story. Would you like a tissue?
I've got them here. I thought I saw you.
Sorry. All right. I have a very special guest to introduce you to. This gentleman is probably I'm not allowed to say this, but he is definitely one of our favourite patients. And in fact, when Tammy is away for 5 weeks soon on a holiday that she planned before she started working here, he's actually told me that he's coming to work here with us, and we will hold him to that, because I seriously think he will be the most awesome team member to have on our reception desk. So we're holding him to that, and I can't wait. So many wonderful things to share with you, not just his story, but his the way he's supported so many others following his success. Sharing his success and supporting other people has just been the most wonderful thing to watch in Kirk. He's only 34 years old. He's lost 80 kilos. He's an incredible family man and a great friend to us, and we just love every single second we have to share his story with you. Please make Kirk welcome.
G'day guys. Well, back in December 2013, believe it or not, I weighed 170 kilos. I'm down 80 kilos.
I see the pictures, I don't believe you.
I was only rang at 5:30 for tonight. I'll show you afterwards.
That's crazy.
My BMI was up around 48, 49. It's down to, which was obese class 3, I think it was. Now I'm down to normal range of, I don't know what it is, 20, I don't know, whatever like normal is on the BMI scale. I've stopped following all that now, so. Yeah, I used to sit around with shift work. I worked for Queensland Rail. Being a shift worker, you sort of sit around when because your shifts and that, you eat a lot more, eat at stupid times of the day. So that was probably one of my main contributing factors to putting on the weight. And I got married again, so I got happy. So, when you're happy, everything just sort of. Yeah, sorry, I haven't really prepared anything tonight.
Would you like me to come and ask you some questions?
Yeah, asking some questions.
Yeah, okay.
Oh, sorry, yeah, I had the sleeve, sorry, yeah.
So let's start maybe with what was the motivator when you first decided that you were going to go ahead with surgery? What was the one thing that said to you, I've got to do something now?
Well, my mum had the surgery back in 2012, I think it was. She had a sleeve, she lost 50 kilos as well. And I saw how well she did, and sort of thought to myself, it's time, I should do something. I'm sick of shopping in the big man section, and even then was getting to the top of that, I was 7XLs. I'm now down to mediums, or 30, 34s, or 82s, or whatever the other scales are.
What about some of the physical limitations? How did you feel that you were living your life at that stage before you had your surgery?
Oh, just so tired all the time. We'd go shopping, and within 5 minutes I'd be looking for a seat, and the wife would be hurrying me out. Just playing with the kids, didn't hardly play with them in the backyard, just couldn't be bothered, too tired, too lazy sort of thing. So
life is completely different. What about some of the things that you've done differently since surgery. I think it's sort of really interesting to note that the guys are generally the ones that go for the thrill-seeking adventure type sport activities, and I think the reason for that is because you couldn't do it before. So maybe tell us a little bit about some of the things that you ventured out to do post-operatively.
Yeah. Well, when I got to 110 kilo was my first goal. I bungee jumped, and then my goal, 20 years was to skydive. So I finally got under 100 kilos, and that was my birthday present / dream come true. So I got to skydive.
And what about now with the kids as well, playing with your kids, active with your kids, you never
Always,
stop?
always out with the kids. We did the colour run, hence the hair.
That changes colour every day.
Yeah, every week.
I love it.
I don't know, 2 weeks ago?
Yeah, it was
2
only
weeks
just a
ago,
couple
yeah,
of
we did
weeks
the colour
ago.
run. There was me, my wife, Felicity, Carol, and a couple of the staff members here. We did it.
A couple of other patients
And
too.
a couple of patients, Felicity, at home, I used to just come home from work, sit down, watch TV. I'd catch up on all my TV shows and just sit there and eat. Now I've still got all the TV shows, but I don't watch them anymore. They're just backing up. Like today, I started work at 4:30 this morning. Haven't stopped since I got home, just doing stuff around the yard.
Would you have been doing things like building your own fences before surgery?
I probably would have, but it would have taken me more than a day.
Okay.
So,
What
yeah.
about theme parks? Is that something you can do with
rides.
kids now?
Rides. I used to call it the walk of shame. You'd get on
When
the
you
ride.
can fit the seat.
Yeah, you get on the ride and you're the one that's got to walk back, and the ride hasn't gone anywhere yet. You don't fit in the seat. The harness just won't do that last little click. And that was really, really embarrassing, especially when your kids are there and they want you to go on it with you and all that. But now I've gone back there and I've ridden all the rides I never could. So it's to be big all my life and then change in 12 months. So I lost all my weight within 12 months. I was down, 70 kilos I'd lost with my 12-month appointment.
Did you have any accidents?
I've got little bits, but now I've got a PT. I've got a PT now. We see twice a week, so
Hence the t-shirt.
So he's bulking me, trying to get my muscles, without having to have surgery. But I've got the bit everywhere. I mean, I'm half my size, so but I'm pretty happy with how it is.
Would you have done anything different? Like, would you have tried to do exercises, like thought of doing them back then rather than now?
I always did want to exercise and that. And when I was big, you just couldn't be bothered, or you're just so tired from work. I do wish I had exercised earlier. I've only been with the PT for 3 months, so even Warren, I was talking to Warren my last appointment. He goes, if you haven't been to the gym now, you're not going. And then my wife joined, so I thought she helped me all this time, so I was going to help her, and now we do PT together twice a week, and she's lost weight just from gym and eating healthy. I've had 12 other people in my life, most of them from work, believe it or not. About 8 of them from work have all had gastric sleeve after me, just to from seeing my results.
It's like influencing a whole entire workplace, and if you can think about the productivity result and the outcome of that entire workplace, that you've got all these people whose energy levels have changed to start with, and their functionality, and probably far less days off work due to illness and sickness because they're so much healthier. I think that is in itself not just kind of from a workplace situation, but all these people who've seen Kirk as a role model, they've watched his story, but they've followed in his footsteps. I think it's an incredible story and a huge credit to you in terms of how you've supported and helped others. And been happy to share the story. It's not for everybody. I don't sort of, suggest that that's everybody's journey, because a lot of people are, very private about this journey, and it's not always something to share. But in Kirk's life, that was appropriate, and it's been, you know, something that it has had such an incredible impact.
Sure has.
Yeah, amazing.
Best thing I ever did. And these guys here, all of them, they're here like a you know, after 12 months even, you know, they'll still help. They're just a few of the guys, well, 3 of the people at work went elsewhere for their surgery because I, you know, obviously I recommended these guys, but they went elsewhere, and they've even said that they've had no support after the fact. You know, once they've seen the psychiatrist and the dietitian before, unless they want their hand out, you know, oh, well, if you want to see him again, you can see him, but, you know, it's still, you know, whatever. And, you know, that was one thing here. Once you've had it, you know, the guys are here whenever you need them.
Yeah, it's a 12-month unlimited program, just so that you know that's the belief that we have in our system, and it's part of what you get when you do come through our system is that 12 months of unlimited support. We do sometimes have to stress to people that that's there for you. You can use it to your advantage. It's up to you. So, you know, it's available. People can come here every single week if that's what they want to do. They have that ability to. And that's actually really interesting. There's some new research that I'm aware of that has come out of Israel about a week ago that looks into results of sleeve gastrectomy patients 5 years post-operatively with and without support. And, you know, it's a really convincing argument and just reinforces for me what, you know, the value of having that team support. I just think it's critical. Yeah. What about, I know a lot of people also want to know about alcohol. You know, you can still have a few drinks, enjoy a social life, go out. Can you tell us a bit about what that's like? Just a little bit like everything.
Back in the day, like a session for me, because I'm a shift worker, you know, my weekends might be a Tuesday, a Wednesday. So Tuesday afternoon, I'd get home from, I'd be off, sorry. I'd get home from wherever and picking the kids up, and I'd hook into the bottle of Johnny Walker, and it'd be gone by 9 o'clock that night.
Athlete.
Yeah. But that's my weekend sort of thing. That was my party. Now I'll have, because I don't drink beer, it's too gassy for me still. I'll have a couple of Scotch and Cokes, pre-mades are pretty much all I can drink because they're not as gassy. 2 or 3 of them, and I'm sort of done. I'm happy.
Itchy,
you know, yeah, I am now.
Yeah, most of our patients become cheap.
Yeah, we surely do. When we go to a restaurant now, I don't usually order, like unless I've had a day where I haven't eaten my little meals like I should have, and I've had, say, 6 hours without anything. I'll order an entree size meal. Apart from that, I'll just, because I've got 5 kids or 4 kids at home now. I've sort of 4 kids and a wife. I just do musical chairs and take a bit off their plate and I'm done. So,
Erin, you've got a question for Kirk?
Yes, I do. How has this, having this surgery done, how has this influenced, I guess, the way in which you, I guess, talk about food or view nutrition when it comes to your kids? I guess, what are some of their questions been about it, and how has this maybe changed or influenced the foods that you might cook at home or nutrition that you might be providing for your family at home?
Yeah, well, with the variety now, there's a lot more things I eat now that I never would try, or, you know, like salmon. I love salmon now, and, you know, 2 years ago I would have even gone near it. You know, that's, but yeah, we've tried to teach the kids now healthier habits when we can, even though the little 4-year-olds determined with their Maccas still and stuff. But but yeah, we, you know, the wife's eating, like I said, the wife's eating healthier and just a different variety of foods we try now than what we used to just have takeaway. You know, we cook a lot more. Yeah, takeaway's hardly there now, which is great because my KFC story I like to tell. They wanted KFC one night, so we had it. I thought, I'm just going to have a bit of that skin. No, straight to the toilet. It was a bit too greasy, so now I don't have. Yeah.
Tanya's about to get a NutriBullet for her birthday, so you'll be into all the green smoothies and
Boost juice. Yeah, we love Boost juice. We live on them. I'm not living on them. So, yeah, but everything's just totally different than it was 2 years ago.
So you say in terms of increased energy levels, obviously your energy now is just nothing
1000%.
compared. So, you know, great story if you think of our theme tonight. You know, Kirk's kind of embodies that, you know, tired and lethargic and couldn't get up and what didn't have the motivation to get out and be active, and it's the complete opposite now. So, and what about energy at work? Are you more comfortable in your work environment?
Yeah,
Just
well,
having more energy?
our job sits down all day, so it's a bit harder, but it's different. It's you feel different at work. You're not uncomfortable on the seats as much now because you fit in them better, and you're not worried about who's
You only
looking.
need one though.
Yeah, that's right. You only need one, not two.
Yeah.
But yeah, it's just everything. You know, we flew to Hamilton Island, and I'd only lost about 60 kilos, and I'm like, these belts do fit normal people. You know, not. I don't know if it'll fit. So just everything, like sitting on a plane, and you know, being so big, your knees touch the seat in front of you. Well, now you can sit there, and your knees don't even touch because you've just shrunk everything. So yeah. So it just changes everything. You know, just everything's different in every little way. So,
Could I have a question online,
Yep.
if you don't mind? It's from Holly, and she just asks, would you give an example of your typical day's food? And is there anything, obviously, apart from the Kentucky Fried Chicken skin, that foods that don't agree with you since surgery?
Well, my days are pretty hard to say because, as I said, I'm a shift worker and I eat, you know, different times of the day. But I try to have a cereal now in the morning, which breakfast was non-existent before. So I always have a cereal first thing in the morning, whether it be at 4:30 this morning or at 7 o'clock when I get up, depending. Snacks through the day, I might have, or for lunch, say, might have dry crackers with the salmon, bit of cheese on it, and just I don't know, dried nuts, just snacky foods like that that keep me going through the day. That you know you don't need many of them now, so you're satisfied with a small amount. I can't eat. Not that I've tried recently, but last time I ate bread because it's real doughy. It just.
Except that burger last week, that was not a good
I didn't have the burger.
Oh, you didn't
I
have
had
the
I had that green.
paleo pasta. That was
Yeah, that stuff.
Greens.
And the chicken.
that was yum.
Yeah, so bread I don't. Last time I tried it didn't agree with me, so I just don't go back to it. I eat Subway. I eat the wraps if I have Subway. Chicken avocado on that. Just love avocado now. Yeah, so that's. And then dinner is just whatever everyone else has usually, except for KFC. But just a smaller portion. So like my steak size now, I used to have the old, they call it the old rib on the bone, big steak. Now I have a little piece of chicken or steak with veggies. So you can still be satisfied with the food. You just got to get used to it again. I always said to my wife, it's like being a baby when you first have the operation. So you're on liquids for 2 weeks, and then you're onto your slushies, and then you're onto your solids. So it's like basically being reborn, and it is. I mean, at the end of the day, you're a new person. So.
Great analogy. Yep. One more question.
How do you feel with your strength training now, and with supplementation? Do you find that you need more, or is there stuff you have to stay away from?
Well, I'm supposed to be having protein shakes. Milk's another thing, sorry, I probably should have mentioned about that doesn't agree with me. I sort of lactose intolerant the way I feel now with milk. I can have it in my cereal, but I can't just get a glass and drink it. So the shakes I can have it on water, obviously with water, but even because they're a powdery sort of milk consistency, it takes me a while to drink one.
Yeah.
And they just, if I drink it too quick, I just feel yuck. But I've been having BCAAs and stuff in my workout when I'm working out.
Yeah.
And another thing, which I can't remember what it's called now, but not supplementing my shake in my water when I'm working out. So.
And probably now that you're exercising more would be a good time to revisit the dietitian and look at the protein intake that you've got and making sure that it's enough for the workouts that you're doing.
Yeah, because because I'm supposed to be bulking. You wanted me to have
You going back to
he wanted me to have bulking muscle that is not weight as such. But he said, oh, you need to have 6 to 7 rice and chicken meals a day. You know, like a plateful. I'm like, yeah, no, that's not happening. So I had mine, but that was just like a little bit of rice, not even a cup of rice, half a cup of rice and a couple of chicken strips just cut up.
Does your personal trainer know?
Yeah, he does.
Yeah.
What? He was saying ideally.
So important to share.
Yeah, he knows all that.
Pretty
Yeah.
cool.
Do you have boomers in your water? Is that the one you have?
Oh, the other one?
Yeah.
No, I'm not sure what it's called. It's another. I know one's called BCAs.
Is that like a hydrolyte type thing?
Yeah, it's protein. You can
Okay,
actually mix with
put in the water.
Oh, okay. Yeah, I'm not sure what the other one's is. He just said buy this, so I did.
Will you just keep losing weight now?
No, I've stopped.
You stopped?
Oh well, I bounced. I'm pretty much 90 kilos. But if I built a fence on the weekend, and by the afternoon I'd lost 4 kilos. But that's just sweat, you know, I was sweating all that. But, you know, but I'm sort of 88 to 90 on average. So yeah, so I've been like that for I think just after 12 months I lost. Yeah, just trying to think of my days now. It's been a while. Just trying to think I think it was my birthday. I was 90 still. Yeah, so around January. So what's that? 12, 13 months. I've lost the 80 kilos, and that was January. So
It's typical to stabilise. Patients don't actually continue ongoing to lose weight. It's, you know, the body's an incredible organ, and generally patients will get to their set point, you know, their goal weight. And in most cases, if they're taking on board the advice of a dietitian and working with their dietitian and getting good nutrition and managing their weight, they're not going to actually continue to lose weight. So it doesn't become dangerous or anything like that in terms of ongoing weight loss. So yeah, fairly standard to get to a goal weight and stabilise and stay there within a certain couple of kilo weight range.
Is that the only, that sleeve, is that the only one that's not reversible?
That we offer, absolutely, yes. It is the only one that is not reversible. The band is 100% reversible, and there's no dissection of the anatomy. And the same with the gastric balloon. It's inserted and removed, and there's no interruption or any dissection whatsoever of the anatomy. Yeah. All right. Thank you so much. Would you stay around and answer questions? So if anyone wants to have a chat with Kirk, he'll be here. And if our online visitors, if they've got any questions, I'm sure we can actually get them to Kirk, and he'll be happy to answer. And he'll be here working in the office in September and able to answer all your calls. So thank you so much. I hope you'll agree that I think there are really two fantastic and very beautiful and inspiring stories to have shared with you tonight. You know, our team, there's only so much that we can share, but the most powerful and the most inspiring of any of the information that we can share is, you know, the results and the patient stories. I think are just spectacular, and that's what we get so much joy in sharing as well, is the journey and those long-term results. It's exciting, and you know, we love sharing it. So you know, the rewards are so many. It's a great place to work for us and to share that opportunity with you. So I hope tonight we've answered as many questions as possible. We're still here, so anything you'd like to know from us, please come and ask. I know cost is always a big question for people, so happy to answer any questions. If tonight's, you know, your moment in time when you're ready to make a start, we're more than happy to help, and we, you know, really love to look after you. So thanks so much for making the effort and being here with us tonight, and look forward to seeing you all soon. Thank you to everyone online also. Thank you very much.
No, it's fantastic. It's a good way to do it. Oh, thank you so much. You're not allowed to run away with that. Sorry?
My daughter's had that.
Your daughter's had that. She wants it out.
And the doctor told her that it's a good operation to have it out.
Why? Who's
Because it's Talbot in Sydney.
I know Michael.
We had it in Sydney.
Yeah.
That's why I wanted to.
She wants to have it out and have it sleeve.
Yes.
She has to have private health insurance to have a conversion. Does she have private health cover?
Yeah.
Okay. I'll only look after private patients because it's too expensive otherwise for them. But she can have the band out and have a sleeve.
Well, they told her there's so much adhesion around it, but it's been in there 5 or 6 years.
That's ridiculous.
She hasn't,
Take it out after
it hasn't been
20
well
years.
since the day they put it in.
That's all wrong. Happy to help her. We can convert her to a sleeve, no problem.
Yeah.
Absolutely. Aren't you lovely coming for your daughter? Good
I
for you.
that balloon even less good for me. I'm even thinking about that myself. So what would they sort of cost? I don't need it.
The balloon. No.
Just to, I mean, who's
I
the
ended
best
up smoking and it just prompts them.
Oh, there's nothing of you. You can come and see the dietitian.
Yes.
Have a chat to her. But yeah, so for the sleeve, you know, she needs to call me. What's your daughter's
Absolutely.
name?
Especially when you're-
Sorry?
especially when you're
Get her to
leaving
call me. I'd love to have a chat to her. I have no trouble whatsoever in helping her. Does she? And she lives in Sydney?
Yeah, she
No,
does
it's no
now.
trouble.
She
She's got
does
patients all
now.
over the world, so it's no trouble whatsoever for us.
Okay.
All right.
She did ask me.
Felicity, just get an
Yes.
idea of costings on the 3 different options there.
Yeah,
What would it be
sure.
roughly?
So, do you have private health cover?
Yes.
Okay. So, what are you leaning towards at the
To be
moment?
honest,
Do you motivate-
well, for a
do
tick
you wanna
off the gastric balloon, I mean, we're looking at the quick
Sorry, do we
BMI.
need to turn that off? We don't want to share your story with
No,
the
you're
world.
dead right.
Sorry.
As long as it's not camera, the camera.
No, no, it's